I want to chat a little bit about fundal massage after delivery. Okay, bear with me here. Fetus, uterus, placenta, cervix, vagina. After the fetus comes out and the baby's born, the placenta comes out. This uterus is now empty. The site of that placental bed, where the blood vessels are, is going to bleed. So it's the job of the uterus, which is composed of smooth muscle, to contract down to stop that bleeding. Now, there are two interventions that can be done to help facilitate contraction of that uterus to reduce bleeding and the risk for postpartum hemorrhage due to uterine atony. Uterine atony is when that uterus doesn't do what it's supposed to do and doesn't contract down, which leaves the uterus wide open and that placental bed capable of continual bleeding. So one thing that can be done, and it is an intervention, is giving oxytocin through the IV postpartum to help contract the uterus down. That's number one. Another thing that can be done is something called fundal massage. The fundus is the very top of the uterus, and it can be palpated or felt through the maternal abdominal wall. Right after delivery, the fundus of the uterus is up above the umbilicus or the belly button. We can feel that, and we can massage that fundus to help the uterus or the smooth muscle of the uterus to contract and close off those vessels of the placental bed to decrease bleeding. Now, it's very common on labor and delivery units for oxytocin to be given after delivery of the placenta, and sometimes before the delivery of the placenta, to help facilitate contraction of that uterus and reduce the risk of bleeding. And it's also common for fundal massage to be done after delivery of the placenta to help reduce the risk of bleeding. Every labor and delivery unit has their own protocol regarding how often they do fundal massage and for how long after delivery of the placenta that they do fundal massage. How long a patient will get oxytocin also varies. Now, what the studies are showing is that when Pitocin or oxytocin, same thing, is given to facilitate uterine contraction after delivery, there's really no need to do fundal massage or uterine massage on top of that. Now, fundal massage, uterine massage can be very painful, straight up painful, especially after having had a cesarean. So I feel it's very important that the nursing staff let you know before they do a fundal massage, and that they also talk to you about why it's necessary in your situation, especially if you're already receiving oxytocin or Pitocin. It's important to know the difference between fundal massage and fundal tone. Assessing fundal tone just means placing their hand on top of the uterine fundus through the abdominal wall to make sure they can feel that that fundus is indeed firm. Fundal massage means you're feeling that fundus and you're massaging it to make it tone up more because it doesn't feel firm. So there is a difference. So be sure to ask questions.